Utthan Pristhasana, the lizard pose, is a powerful hip opener that stretches the hip flexors on one hip and the hip extensors on the other. Start in a downward dog. Then step your leg forward and place the foot at your hand line, either on the outside of the hand or between both hands, and then reposition the hands. Your front knee should be bent, with your toes and hip turned out to the side. Your back leg can be straight or bent depending on your preference. Keep the elbows at the shoulder line with the forearms and fingers spread on the mat. Maintain a neutral neck position with gaze focused toward the ground. The movement in the hip joint of the forward leg is flexion. In a chain reaction, hip flexion tilts the pelvis posteriorly and flexes the lumbar spine. The muscles stretched in the forward leg are gluteus maximus, hamstrings, adductors. The quadratus lumborum is stretched with flexion in the lumbar spine. Part of the hip rotator group, among them the quadratus femoris, is stretched with hip flexion. The posterior ligaments surrounding the hip joint are stretched. In the rear leg, hip extension stretches the iliopsoas muscles that connect the hip to the pelvis and the spine. In addition to hip extension, posterior pelvic tilt adds more stretch to this muscle. Another variation for performing the asana. Performing the pose with straightened rear knee in the air and toes digging into the ground. This variation of the pose is more active mainly in regard to the rear leg as the toes dig into the floor. The gluteus maximus of the forward leg is dominantly active in supporting the body. The hip flexors, iliopsoas rectus femoris, are stretched and active simultaneously. The quadriceps stabilize the body. This muscle is active in both legs. The hip adductors are stretched and active simultaneously to stabilize the body. Common problems and adaptations. Common problem: cervical tension caused by raising the head. Solution: turn the gaze downward and maintain the cervical curve in a neutral position. It is possible to use visualization. Imagine holding a small ball between the chin and chest and not letting it fall. Common problem: difficulty in attaining the initial stage of the pose in leaning the forward foot forward with full range of motion because of shortened hamstrings and/or gluteus maximus. The asana is entered from the dog pose with both hands on the floor. From this position, it is difficult to transfer the foot forward between the arms. Moving the foot forward requires bringing the thigh to the chest. Hip flexion stretches the gluteus maximus and the hamstrings. In addition, knee extension is required to allow the foot to move forward. Tight hamstrings will pull the lower leg backward and not allow the knee to straighten, and shortened hamstrings will not allow full knee flexion. Solution: A. Enter the position from a standing pose instead of from the dog pose. From standing, taking the leg one step backward, squat movement, makes a greater range of motion possible. B. Reach the position from a starting position on hands and knees. C. Use the hand to help place the foot in the same line as the hands. Common problem: difficulty in attaining the initial stage of the pose, in leaning the foot forward with full range of motion because of a limitation in the range of ankle dorsiflexion and shortening of the plantar flexor muscles. The asana is entered from the dog pose. To move the foot forward between the arms, the exerciser must bring the knee to the chest and perform ankle dorsiflexion so that the foot does not get stuck on the floor. Many exercisers have difficulty in performing this ankle dorsiflexion because of limited range of motion and/or plantar flexion muscles. In order to perform ankle dorsiflexion, the dorsal flexors become active, and on the other side the plantar flexors are actively stretched. A shortening in these muscles will not allow exercisers to perform full motion dorsiflexion, and the foot will get stuck on the floor. Solution: perform a variation beginning from a full standing position. While standing, one leg is led backwards, as in a backward squat. In this variation, too, the forward foot is in dorsiflexion, but this time it is the result of passive stretching of the plantar flexors. The dorsal flexors do not have to strain to move the ankle. Therefore, it will be easier to attain the range required for the position. Common problem: difficulty in leading the forward leg forward with full range because of weakness of the scapular protractors. Entering the asana begins with the dog pose. In order to transfer the leg forward between the arms, the exerciser must push the chest upward in order to make room for the leg. The chest is pushed mainly by protracting the scapulae, using the serratus anterior muscle. Weakness in this muscle leads to sinking of the chest and lack of room for transferring the leg. Solution: preparatory exercise to strengthen the serratus anterior muscle, placing the hands on an exercise block or two. Common problem: limited range of flexion in the lower vertebrae that limits the ability of the forearms to reach the floor. Solution: A. Place the hands on an exercise block or two. Adjust the block height to the exerciser's range of flexion. With improvement, it will be possible to place the forearms on the blocks. Second picture. Common problem: shortening of the flexion muscles in the rear leg limits the range of movement in leading the leg forward. It reduces the length of the step. Why does this happen? Shortening of the iliopsoas muscle in the rear leg pulls and rotates the pelvis anteriorly and does not allow it to rotate to the rear. Lack of posterior rotation does not allow the forward leg to perform the full flexion and bring the knee to the chest. As full hip flexion is dependent on posterior pelvic rotation, one side affects the other. Solution: support the hands on two blocks and reduce the distance between the legs.